Welcome, Professor. Thank you for your time this morning. Can you tell us just how important increasing the price of tobacco through tax is for driving down the prevalence of smoking?
So we know from hundreds of studies around the world that increasing taxes is the most effective policy we have for reducing smoking. So when you increase tax and increase price, current smokers try to quit, effective in keeping former smokers from taking it back up. Our work shows that kids are particularly responsive, so very effective in keeping kids from taking up smoking. And as a result, you see the reductions in prevalence and then all the consequences that go along with that.
Have you seen that evidence in Australia as well?
Oh, absolutely. So Australia is very similar to what we see in other high-income countries. Every time the tax has gone up, particularly some of the recent tax increases, the big increase in 2010, and then the more recent annual increases, we've seen consumption continue to come down. We've seen prevalence continue to come down as a result.
And the leading country in the world on tobacco tax?
It depends on how you want to define the leading country. I think countries like Ireland, the UK, Australia, New Zealand are among the leading countries in terms of having relatively high taxes and prices and having policies where tax and price are continually increased over time. So I think there's been big effects in these countries, but then I also look at countries like Turkey in particular, where they started out at a much lower level and have been much more aggressive in a relatively short period of time, pushing up taxes and prices. So their prices are not as high as you see in some of the other countries I mentioned, but their tax has gone up substantially and contributed to big reductions in prevalence there as well.
Critics say that the policy is regressive and has a major negative impact on low-income people. Have you a comment on that?
Oh, absolutely. So I think there's a couple of things to focus on. One is we know that low-income smokers are most likely to quit and cut back in response to tax increases. So you actually get a very progressive health benefit. You see bigger reductions in tobacco use and as a result bigger improvements in health in the lowest income populations. And as a result, the burden of the tax increase actually falls on higher income smokers who are more likely to continue. So it reduces the regressivity, the financial regressivity. But there are many smokers, because of the addiction, who aren't able to quit, and a higher tax then does adversely affect them. And that's why I always think it's important to think about how the revenues from the tax are being used. And taking some of those revenues, putting them back into efforts to help low-income smokers quit is going to be particularly important. And then also using some of those revenues to offset other financial impacts is going to be important in dealing with the smokers who can't quit.
Australia collects about $8.5 billion in tobacco tax. Is it possible to model when there might be a tipping point and the government starts to receive less income from tobacco tax?
That will likely happen at some point. We haven't seen it happen yet around the world. So countries, even with high taxes, who increase their taxes continue to see increases in revenues. But eventually that will turn around. Exactly where that's going to happen, we don't know yet. And that's part of what we're trying to figure out with some of the research that we're doing now.